general population, Dr. Mendelsohn, be aware of how to talk to their medical doctor?
In order to know how to talk to your doctor, a person first has to learn what the doctor has learned in medical school. A doctor learns very little in medical school about disease and about drugs. In a total of 4 years of medical education, a doctor learns a total of 60 hours of formal pharmacology, which means that he gets the major portion of his education for the rest of his life, as far as pharmacology is concerned, from the detail man from the pharmaceutical industry. He learns nothing about nutrition, because doctors don't believe in nutrition. Doctors believe in better living through chemistry. He doesn't learn geriatrics or gerontology. He doesn't learn physical medicine and rehabilitation, so he doesn't know anything about exercise, and he doesn't even learn about emergency care. As a matter of fact, in most medical schools, emergency care is an elective subject, so you can expect the EMT, the emergency medical technician, to know more about emergency care than the graduating physician. But a doctor does learn something in medical school. He learns the catechism of his religion in that seminary, which he calls a medical school. And it's important for patients to know what that catechism is. It goes something like this. If you ask a doctor a question, his answer is, "Just trust me." Unless you're a woman, then it's, "Just trust me, dear." If you come to the doctor with information that is different than the information that he has given you, his answer is, "What medical school did you go to?" If you're an older person and you come to the doctor with a complaint, his answer is, "What do you expect at your age?" And that's why I tell all older folks that when you go to the doctor and he says to you, "How old are you?" tell him you are 35 years old. And if he starts to argue with you, you ask him, who knows your age better, you or he? If the doctor doesn't know the diagnosis, he says, "It's all in your head." And if he doesn't know the treatment, he says, "You'll just have to learn how to live with it." And if you've had good luck by going to a practitioner who's outside of medicine, say a chiropractor or a naturopath or an iridologist or an acupuncturist or a nutritionist, and you recover, if you tell that to your doctor, he immediately says, "You're lucky." If you ask your doctor, "What are the side effects of this drug?" he says, "You take a risk every time you cross the street." Because the doctor is taught that when you cross the street, you are crossing the street blindfolded. He doesn't recognize that in contrast to his advice, when you cross the street, you have a chance to look both ways. So I think the most important answer to your question, Esther, is that in order to know how to talk to a doctor, you have to know in advance how the doctor is programmed to talk to you. I'd like to point out that medicine today is not a science. Almost nothing in medicine has ever been scientifically proven. Instead, medicine today has become a religion, a belief system. The doctor is the high priest of that system, and he's a very powerful priest, because who else can tell you to take off your clothes and you'll usually do it? The doctor practices in a temple, which he calls a hospital, which I call a temple of doom, because you can pick up germs in the hospital you cannot get anywhere else in town. Now, I am the doctor, and you people are the laity. And the laity are a little bit stupid, or deaf, or mentally retarded, or a combination of all three, because they cannot understand the arcane mysteries of our religion. And therefore, we doctors will do our best to keep those mysteries hidden from the general population. For example, as in any other religion, we will talk in a secret language. Some religions use Hebrew, other religions use Latin, other religions use Arabic. The religion of modern medicine uses Greek. So I would never say that a patient is blue if I can say the patient is cyanotic, which is Greek for blue. I would never say the patient picked up an infection in the hospital if I could say the patient developed a nosocomial infection, Greek for he picked it up in the hospital. I would never say that I don't know the cause of a disease. Instead, I would say, this is an idiopathic disease, Greek for I don't know the cause of the disease. And certainly I would never say that a doctor caused the disease. Instead, I say, this is an iatrogenic, Greek for doctor-produced disease. So my answer to you, Esther, is that the doctor today behaves like a priest. He has a peculiar way of speaking, he has a peculiar way of thinking, and he has a strange set of ethics.